ERAS protocols, in my mind, are the practice of optimizing the care for our patients around the surgical episode. And I think one of the farces is that it is just immediately what happens in the doors of the hospital, but really it starts from the moment we decide that the patient needs surgery. These are centered, or should be centered, on evidence-based care, and the care should be multidisciplinary, not just the surgeons, but the whole care team, from pharmacy to nursing to anesthesiologists and more. What it did is really change longstanding dogma of surgical care and replaced it with modern perioperative care theories. These have helped to drive great outcomes like reducing length of stay and readmissions and complications like SSI and respiratory complications and VTE and more. And from the patient perspectives, which is the most important part, they feel better after surgery. They feel better the whole time during their recovery. And they get to experience less nausea, less pain, and return to a better functional result faster for them. And this, in turn, then impacts society, from the family and caregivers and the workforce, but also hospitals and more.
The amount of resources available to actually deliver the care is a challenge, especially as healthcare systems are increasingly strained. Knowledge, like not just being aware that ERAS guidelines exist for a certain type of surgery, but really knowing what the recommended care is, was still a barrier. And also institutional support. So having almost like the top-down kind of influence, saying like, we believe in this, we want our care to be aligned with this. Those are some of the common barriers that we found. So I think, creating strategies to overcome those barriers and leverage any facilitators, like the belief in benefits from implementing ERAS, are what's really going to improve the implementation and compliance with ERAS guidelines.
The first and foremost thing for a surgeon, for the hospital, for a specialty, is you need to find a multidisciplinary care team that is engaged and get buy-in from the core team. It doesn't have to be huge, but it needs to be the few people that can make a difference and whose voices are positive and matter. And they don't have to be the biggest voices. They just have to be the positive ones. So develop that core team. Next, get a plan that's doable and that you can be flexible with when you might hit a few barriers. And then from there, most importantly, to make this be maintained and to expand, is share the success story. People want to be a part of a winning team.